Hey guys, we're here with Austin. He's going to be doing your frequently asked questions about scoliosis, adolescent idiopathic scoliosis. And so I hope you guys find this helpful and informative. Austin, what are the patients asking? What kind of questions are coming up in clinic?
Yeah, I've noticed a lot of some of my friends have been asking this, but what is scoliosis?
So when we're talking about idiopathic scoliosis, I'm talking about this curvature of the spine that's happening in around the time of puberty. So, you know, we're talking about maybe age 9 or 10 and progressing over the next 4 or 5 years. And that's the type of scoliosis. There's other types of scoliosis, but this video and this information is for those patients. So it's typically young females, and there's a rotational deformity of the spine, and the spine tends to bend, and it can bend in different directions, either forward and back or to the side. The most common would be to the side.
Mm-hmm. Is there a reason why scoliosis happens?
We don't actually fully understand why it happens. There's lots of different theories. Some of these are genetic, some are environmental, some have to do with blood supply, some are autoimmune. We don't actually fully understand it, but we do understand lots about it. We just don't understand exactly why some kids get it and some kids don't.
In your opinion, when does scoliosis need surgery?
The typical answer to this is curves hitting 50 degrees. Now, some kids have curves that are less than 50, but they're really noticeable and it bothers them and they want to get it fixed. Some kids have curves that are 50 or even more, 60 degrees, and they don't want surgery, and we don't have to do surgery in those cases. So these are not black and white, rigid criteria. You don't have to do anything. But in general, there's a recommendation. The thought is that if it goes above 50 in certain time points, especially as you're growing, that it's more likely to progress. Mm-hmm. Now, we also do adults, and so sometimes we've decided not to go ahead with surgery, and sometimes we've been able to watch these for years and not see them progress, right? So it's not black and white, but it's something we can talk about.
The next question here is, what is the surgery like for scoliosis?
So when we meet in the clinic, we look at the x-rays and we kind of decide what curves need to be fixed. There's usually 1, 2, or 3 curves. And then we select the levels that we're going to do. And then surgery involves putting screws at those levels and then releasing the spine to make it more mobile, and then putting rods in to put the spine where we want it. Rather than where your body's put it off to the side and curved and rotated, we bring it back to where we think it should be.
Mm-hmm. What is the type of correction that comes with these types of surgeries?
So we're using fixed angle screws, very rigid implants, so 6mm cobalt chrome rods with releases. So we're getting very high correction rates, like 80+% at least, depending on the curve. Now, curves that are over 100 degrees have a little bit higher risk, and maybe we don't get as much correction. Curves a little bit smaller get a higher correction with lower risk. So with some caveats there, we do have a very high correction percentage with the options that we select here at the hospital.
Mm-hmm. And what is the typical hospital stay like?
Usually for adolescent scoliosis, 3 to 5 days in hospital.
Mm-hmm. And after the surgery, what are the follow-ups like?
So after surgery, we're going to see you at 2 weeks where we check the skin, make sure everything's healing up nicely. Throughout this time, we have constant access to our office and secretary through text message or telephone for any concerns, medications, etc. After 2 weeks, we'll see you at 6 weeks. We get x-rays then. We see how things are going. Usually kids are sort of back at it now, between 2 and 6 weeks, back to school, all those things. And then we see you at 3 months, 6 months, 1 year. And typically we'll do a 1 year, maybe telephone call or x-ray touch base and just see how things are going after that.
Post-op, are my parents allowed to stay with me in hospital?
If you are under the age of 18, then yes, you can stay overnight. Over the age of 18, the rules have been changing about overnight visitors. Most of the time it's not a problem, but they're depending on the fullness of the ward, sometimes there's issues with kids over 18.
Mm-hmm. And now, when can I go back to school?
Back to school, usually we're off for a few weeks. So if you have online classes, it's a little bit different. But full days sitting down in the chair, usually it's a couple of weeks to 3 weeks, between 2 and 3 off, and then you're back at it.
As a person myself, I love weightlifting. When can I get back to sports?
Sports, I'd say, depending on the sport, it's a few months. So if you want to do contact sports, Depending on the fusion we've done, typically I wait 6 months or even longer in some cases, depending what you're trying to do. If you're doing light sports like swimming, those types of things, we can probably get you back closer to 6 weeks to 3 months.
And what are the different complication rates?
So the complication rates are very low, but they're obviously very serious with spine surgery. So we always worry the dreaded, risks of heart attack, stroke, and death. These don't typically happen in kids. The most feared complication would be paralysis, losing function in the legs. I've never had that here, but it is reported, of course. Things like bad screws and things like that can cause that. Again, it's very rare, but it's something we worry about. And then more likely risks would be either having an area that doesn't heal, less than 1%, having an infection, like 1 to 2% or less. I've not had many of those, but it's something that we certainly watch for.
And I think the last question here is there anybody I can talk to about this?
Yeah, we have lots of families and patients that have come through, had their surgery, and have been open and willing to talk to other patients. So if you have concerns, you have questions, you want to talk to other patients that have been through it, hear their perspective, hear what their story is like, you let Lou know, and then she can put you in contact with those patients and families, and you guys can connect together. And we found that very helpful. Yeah.
I think that's all the questions I have for today.
Awesome. Thanks. So we hope you guys find that useful, and we'll see you in clinic.